Dr. Mary Bassett, thank you so much for joining us. Really excited to talk to you as we celebrate HealthRight's 30th anniversary. Of course, you're the former Commissioner of Health for New York City, and you're now the director of the FXB Center at Harvard University. And so given that Jonathan Mann founded HealthRight and also founded the FXB Center at Harvard, and your wealth of expertise, really excited to talk to you today about issues around Jonathan and Jonathan's legacy, this notion of health and human rights that he's really considered the father of, and its relevance to today. I'm hoping to the moment that we're in today, this sort of pandemic moment, this racial justice moment. And I'm hoping that we can get a little bit into COVID. Love to get your take on issues around COVID, our response, global response, and the way forward. So thank you so much for taking the time to join us today.
Well, I keep learning about Jonathan Mann because I didn't know that he'd founded HealthRight. And you're right, he founded the FXB Center for Health and Human Rights. And I do consider him the father of the idea that we have to link health and human rights. Think of how each influences the other and how we will do better at advancing health if we consider these jointly. So he's been a really important person, and now I know more about him.
Yes. Well, likewise.
And I think lots of researchers and activists are seeing analogies between what we're witnessing with this novel coronavirus that causes COVID-19 and 30 years ago when, and HIV hasn't left us, mind you.
Right.
When many of us were working on the HIV/AIDS epidemic around the globe. So they are tracking along the fissures of inequality, marginalization, discrimination, and people who are deprived of their rights are people who are more vulnerable. And that was really the core thinking of Jonathan Mann, that people who lack rights also are deprived of fair access to healthy lives.
Yeah. So you make it a critical point about sort of the intersection of health and human rights in the context of COVID. What, as you reflect back on the HIV response, we're roughly 30 years into the HIV response as well. What lessons do you think that we as a global community, a public health community, have learned from the global HIV response and can apply to COVID, or what have we not learned as you reflect on that response and the response that we're in the midst of now?
Yeah.
What are some of the lessons learned that we've either learned or not learned as we try to confront COVID?
Well, I mean, I think we have to all admit that we haven't learned our lessons. I mean, look at the catastrophe that we're witnessing unfolding, particularly in the United States, which although it comprises less than 5% of the world's population, has between 20 and 25% of deaths. So this is, unfortunately, entirely predictable, given the way we have organized our society and the levels of inequality that have emerged. So I think what Jonathan Mann really did with the framing of health and human rights was give permission and in fact demand that people look outside of the healthcare sector. HIV was thought of a problem of a virus and a set of personal behaviors that we were hoping to find a biomedical treatment for. But that wasn't the actual story. That wasn't what was driving transmission around the world. It was much more discrimination, marginalization, impoverishment, high levels of military mobilization, gender inequality. All of these things are what Jonathan Mann came to talk about and really demand that the field talk about. And I think that was an important lesson, that when we see epidemics and pandemics, that they're not purely biological phenomena, that they have to do with our societies. They show us who we are. Mm-hmm. And, he made it possible to talk about HIV in different ways. But if I'm honest, it was the activists who really changed the story.
Right.
And, many of us in the medical field, and I'm a medical doctor, really have to bow down to the grit, determination, and sacrifice of AIDS activists. And they're speaking out on COVID too, actually. Yep. So, but we don't have that same phenomenon. Mm-hmm. And, we need it. We need a mass movement.
Yeah. Yeah. What would that, in your mind, what would that movement look like? Would it be a movement that's focused more broadly on socioeconomic drivers of poor health, so broader than just COVID?
I think it would be about
focused, or what?
Yeah. That's what I think.
Yeah, it's funny. I think HIV was so one of the powerful things about the HIV pandemic is that it was so revelatory about these sort of intrinsic structural inequalities, and COVID is sort of is sort of revealing those kind of in a slightly different way, but all over again. If I could dig a little deeper, given your background and experience heading up a city health department, the largest city health department, and arguably the gold standard for municipal health departments around the world. How do you, as you watched the sort of chaotic response that has unfolded in this country to COVID, how do you think about the roles in an emergency situation like this? How do you think about the role of the federal government, the state government, and city health departments like the one that you ran? How, in an ideal world, how would their sort of the role differentiation shake out in a response like this? What would you have liked to?
The first thing to say is that we haven't seen public health in the lead. Mm-hmm. So our federal agency, the Centers for Disease Control and Prevention, is practically absent.
Yeah.
And so as a result, responsibility fell to the states. Ideally, you would see the federal government taking the lead. That doesn't mean that they're demanding that every state and every jurisdiction do the same thing. Yeah. But there needs to be a strategy for the whole nation. I mean, we can't close borders between states or between towns and the communities adjacent to them, or cities in the suburbs, with one nation. And there should be one plan, and it's the federal government that's responsible for that. So we've had a failure at federal government. And then we had the fragmentation and chaos of state leadership with different degrees of success in different places. Now, a local jurisdiction like the New York City Health Department, which is an extremely well-resourced health department, its budget is not that wildly different than the Centers for Disease Control.
Right.
So, city health departments that are big and well-resourced have the capacity to act with more agility than federal or state levels. And, it's been difficult to watch the similar marginalization of the health department that we've seen happening at federal level seem to be replicated on down the levels of government in this country. It should be public health in the lead at all levels.
Yeah.
I haven't seen that.
Yeah. And so given the lack of coordination, how do you see this?
It's a lack of investment in science.
Coordination, right.
And the unwillingness to let the people who actually know how to respond to a highly contagious virus for which we have no vaccine and no cure. Let them, take the decisions. I even hear friends of mine arguing that it now should be community members who, make these decisions about whether we open schools or not. And this is kind of crazy.
Mm-hmm.
Expertise has a place, and we should respect it. And there's a lot of expertise in this country.
Yeah,
that's not the problem.
Right, for sure.
Yeah.
And so, are there any new lessons from COVID? Certainly this is not going to be the last pandemic we face.
No.
Are there critical lessons that we've learned here that we haven't learned before? And one of my reflections has been that it seems to me that in a nationwide response, which is what, as you've pointed out, is required, a coordinated response across the country, is that we have, if you're asking people to make significant sacrifice, like shutting down completely for a period of time, you sort of have, for me, one of the things that I learned is that you sort of have a window of opportunity.
Right.
And then that window kind of evaporates because I think you can only get people to really comply with clear communication and clear directives and for a finite amount of time. And if we had successfully shut down in the way that eventually Italy did, we might be in an entirely different place.
Right. And we're going to have to revisit that.
Yeah.
I think it's inevitable.
Yeah.
So you're absolutely right that what makes sense to me is that the shutdown is to do a couple of things. One is to reduce community transmission to a level where contact tracing becomes feasible. If nobody knows where they got anything because it's spreading everywhere, then contact tracing doesn't work. So you keep people from mixing, you lower transmission, and then you put in place the testing capacity that is needed so that you have adequate testing, and you put in place the capacity to identify and stamp out new chains of transmission. And then there are lots of smaller parts of this or subsets of this. Now, most of the deaths so far have been in elderly people. And so clearly the nursing homes were not given the priority that they needed. And we know that, these congregate settings, which include the prisons and jails, are places where people are highly vulnerable and need to be protected. So, this is not rocket science. This is something that remains doable. And there are people who know how to do it. They need to be put in charge.
Yeah. And so how do you see if the status quo is maintained, which would be really unfortunate, how does this thing play? Well,
for one thing, I don't think that anyone can think, if there are people who do, that the inequities will result in this just killing off people whose society would be better off without anyway, meaning people of color, old people. When you have a highly contagious virus circulating, it is a danger to everyone, no matter how much resource they can mobilize for their personal protection.
Yeah.
So that's the first thing. And we also don't know that much about this virus, right? We're seeing younger and younger people affected now, which makes sense because they're the ones who went out there and started mixing the most.
Yeah.
And so the first thing is that there should be a societal agreement that we need to protect one is to protect all. But I think we'll continue to see unfolding these huge disparities by race, ethnicity, income. And right now, the federal government isn't making the data available that would enable us to assess that. Yeah. And that is actually kind of criminal. So we have now race, ethnicity, and gender. We don't have educational attainment, which also appears on on death certificates. So educational attainment also appears on death certificates. So that would enable us to look at across race, ethnicity, at what's happening to people with lower educational attainment, which is probably our best available indicator of socioeconomic status in terms of death certificates. So, we don't even have data that would tell us where we are.
Yeah.
And it's there, by the way, it exists.
Yeah, yeah, for sure.
It's not being made available.
And as we look to remedy the shortcomings within our healthcare system and beyond, and certainly there are sectors beyond healthcare that are implicated here, and you've made that very clear from your remarks. In broad strokes, how do you think about it as we do think about a future pandemic and learning lessons from this and preparedness? And aside from the really obvious ones around a coordinated response, what are some of the key things from a systems perspective, from a policy perspective, at a higher level that is this simply around? Is it enough to just ensure universal health coverage, or what are sort of?
That is not enough. A colleague of mine was just explaining that in the UK, which has a national health service, they're seeing racial disparities that are just as large as the ones that we see here, with a fourfold excess risk of death among, I forget, they have another word that they use in the UK for people of color. Mm-hmm. So they are seeing it higher among people of African descent, South Asian descent, and they have a national health service. So that's not enough.
It's not, and of course, we already know in this country, we know in this country that maternal mortality among women of color is
middle class,
several times higher than for
So we're seeing these big gaps, but they're not, and they're not ones that we can attribute only to lack of access to medical care. Not that I don't agree that that's important, and I consider it a human right that people have access to medical care. But we also have the problem of lack of affordable housing. Too many households are way overcrowded. If they have somebody who has COVID, they have no capacity to isolate them, or someone who's exposed, they have no capacity to practice quarantine. Right. And there are just too many households like that. And then there's a large number of people whose jobs are considered essential, who are still going to work, still getting on public transport, still going to workplaces with assembly line type working conditions, where the social distancing, actually physical distancing, just isn't possible. So these are all things that have to be fixed. And they're being asked to keep going to these jobs, and they don't even get a living wage for them. Right. So people are literally being asked to risk their lives to work in warehouses where the money they earn doesn't really support their family. So all of this is, needs to be addressed, or we will continue to be vulnerable. So we have the problem with the public health infrastructure. We have the problem with the coordinated response, but we have these deep social divisions in our society, which will continue to make us vulnerable. And they are related to depriving people of their rights, their right to shelter, their right to, I'm afraid, to vote, their right to leisure time, all of that, as well as their right to healthcare. So which brings us back to the start of our discussion, which was around Jonathan, and how really one of the most important messages that Jonathan sort of perpetuated was this notion that health, the broader determinants of health are just as important here, and these pandemics, whether it's HIV or COVID, reveal these sort of structural deficiencies, these fissures in our society, where there are these critical gaps that make certain communities more vulnerable to everything from chronic diseases to infectious diseases, et cetera. So absolutely right.
Yeah.
I mean, it's right. So we are a very wealthy country. And the resources exist to fix this. But there has to be a willingness to spend them in this way. And I haven't seen that yet. As we're witnessing, the emergency release of resources has been ended.
Yeah. Yeah. Well, Dr. Mary Bassett,
that work for you? Yay.
Thank you so much. I really appreciate you taking the time to share your thoughts with us at this really important moment, and for joining us to celebrate the 30th anniversary of HealthRight and the great legacy that Jonathan left all of us. So thank you so much for taking the time to chat.
Absolutely, my pleasure.